Hello and good day. I'm Dr. Vijay Kumar, Director of Neurosurgery and Spine at Fortis Hospital, Anandapur, Kolkata. Today, I'm going to talk about anterior cervical disc replacement. Now, this is a new motion preserving technology, actually not very new. It has been around for almost 20 years now, but it still seems to excite a fair amount of questions and debate. So, what is an anterior cervical disc replacement? So, traditionally, if you have a diseased cervical disc which is causing symptoms or causing pressure on the spinal cord, then the gold standard operation that we have performed over the years is what is called an anterior cervical discectomy and fusion. This is done through a microsurgical approach, through a small incision in the front of the neck, and has had wonderful results which have been proven over time. But obviously, anything can be bettered. At least the attempt to do so can be done. And disc replacement is a motion preserving technology where instead of taking out the disc and fusing it either with a bit of bone graft or a cage and a plate, we put in what is called an artificial disc. This artificial disc permits the similar range of motion as the normal cervical disc would have permitted. So, is this technology applicable for everyone? Yes and no. Normally, we reserve disc replacement for young, fit, healthy patients who do not have very gross degenerative changes or who do not have a lot of ossification in the spine. If it is an older patient, if they have more pronounced degenerative changes, and particularly if they have any deformity in the neck, then the traditional anterior cervical discectomy and fusion is the usual choice. Your best guide to whether a disc replacement is suitable for you is to ask the concerned neurosurgeon, and normally they would give you both the options. Obviously, the way of performing the technique of the surgery and the technical results are almost the same for both procedures. Thank you.